So thanks very much for inviting me along today, Miriam, and thanks to everybody for taking the time to listen. My name's Claire Coburn. I work for East Renfrewshire Council, and I have responsibility for our Fairer Scotland duty, along with child poverty and inequalities, and I kind of sit in the community planning team, so very much working across the different partner organisations as well as the local authority. So I suppose at the outset, I feel like a bit of a fraud turning up here, particularly after David presented so eloquently and told us about, having his business case and the planning that they've done and all that kind of how it's been going on for a long time. And what I'm going to talk to you now is basically about how much I have been shouting and not shutting up about socioeconomic disadvantage to all those people that would listen to me as we've been starting to look at our recovery work in relation to COVID-19. So perhaps taking a slightly less strategic approach than David has described, but I think what both David and Miriam have spoken about is this, the importance of raising awareness with the board. So I'm going to go with that wording then, that I've been pressurised to raise awareness. So we have, in East Renfrewshire Council, we had obviously the same as every local authority in terms of when the pandemic hit. So March 2020, we all sort of went into crisis mode. We were all firefighting. We were doing whatever was needed to be done at that time in emergency situations. So we're gathering up food parcels, we're delivering pharmacy prescriptions, we're helping elderly people out, we're looking at where support was needed, and it was all very much reactive. And we talked about there being a big element of response. As we started to get into the summer, we started to maybe start thinking about how do we rebuild? What's our recovery? What's our renewal? Ironically, this time last year, we all thought that we were then, things were coming back to normal. So we started planning for recovery and renewal. And at that point, we brought together various kind of board members and senior leaders. So our corporate management team were meeting on a really regular basis. We had set up some member officer working groups. So our elected members came around the table along with some of our crisis resilient management team, and various people came together. So we had these member officer working groups to start thinking about what's our recovery and renewal plans. And at that point, I had been involved in some of the response work and sort of got my foot in the door to make sure that as those discussions were happening, we were always considering socioeconomic disadvantage in that sphere as we're thinking about recovery and renewal. So it was really just about getting poverty, getting socioeconomic disadvantage on the agenda. I'll be honest, I don't think we used for the Fairer Scotland duty. I don't think we referred to the Fairer Scotland duty or the need to do it, because actually it was just an inherent part of what we were doing in recovery. So we weren't doing it because we were obliged to, but we were doing it because it was the right thing to do. So it was about having a really kind of basic conversation with some of these people on these boards around what impact we were seeing as a result of COVID. So essentially, people were seeing that their income was reduced and their cost of living was increased. And it was as basic as that. It was going back to the drivers of poverty. For anybody who works in the child poverty sphere, they'll be aware that they talk about income being reduced from employment or from social security. So we talked about employment differences that we've seen. People have been made redundant, perhaps they're on furlough, as Miriam mentioned earlier. People have got childcare responsibilities now. The schools were closed and kids were at home and they couldn't do the job that they previously did, or perhaps their industry wasn't open and they were struggling if they were self-employed, for example. So it was about understanding that had an impact on so many people, and particularly, as Miriam had mentioned before, those who were experiencing low income beforehand were likely to be the most affected by that. We also talked about income being reduced from social security. So some of the sort of government schemes that were put in place, it took quite a long time, for example, for self-employed residents to find that support funding come through to them. So they've had a loss of income, and in some cases people were losing half a household income if they had two working parents, for example, and one was had lost their business, but they didn't have the support, they didn't qualify for universal credit, but actually it'd been quite a big difference to their income in the household. So it was having that kind of discussion, saying to people, think about the the income that people are seeing missing out on here. And again, picking up on the priority groups, who's been most affected? The people who are most likely to be affected were those who were already on low income jobs, who were out of work, perhaps lone parents. Miriam's mentioned women as well, disproportionate impact of caring responsibilities there. We also talked about the fact that the cost of living had increased, and again, Miriam had touched on some of this earlier on. Through the pandemic, costs of food had increased for a lot of people. Perhaps they couldn't go to the supermarket that they would normally go to. Perhaps the older people were relying on a daughter or son coming and taking them for their weekly shop, but they couldn't do that. They were having to go to the shop within walking distance, which perhaps had higher costs. I'm sure, having additional family members at home, for some of us having kids who were here all the time, constantly eating, for others who maybe had extended family members who moved in with them. So those costs around food, electricity, general running of the house would perhaps have increased. And again, some of the national picture information we were getting was telling us that, those who were on low incomes or who were experiencing poverty before the pandemic, we're going to have seen that disproportionately increased. Perhaps they've got larger families, they've got more children, they're overcrowded households. And again, that links in with some of the stuff Miriam spoke about earlier around the protected characteristics as well. We spoke again about cost and digital access, which I think we're all aware of. So that's actually the physical provision of devices, which we, as we'll be aware, Scottish Government provided lots of devices to people, but it's the connectivity, it's about the number of people in the household all trying to access them and how that has an impact. And it was that, like I say, sort of that loss of family supports which they might have had before, and sometimes that can maybe have increased the cost of living. And what we were seeing from a national point of view was, we're hearing anecdotal feedback, and we were also getting some national early level findings around, how were people dealing with the situation. They were running down their savings if they had them, perhaps borrowing from family and friends. Maybe they were having to cut down on their spending, so buy cheaper or less healthy food, juggling bills, missing payments, maybe relying on more charitable support, either informally or formally. Looking at the government income support schemes, which rolled out after a time, and where they were eligible to claim new benefits, they were doing that. So this, as I say, this was a conversation that I was having with senior leaders back in summertime. As things went back into lockdown and we started to get a bit more of an understanding about the longer term implications, and that we weren't quite at recovery and renewal, we started to change the dialogue. It started to be more around the 4 harms. And I don't know if many of you have seen this, but the Scottish Government had framed a lot of their information around the 4 harms of COVID, and this kind of fitted in our dialogue. It made sense to us and it helped for planning. So the first of the 2 harms are the health impact, so direct COVID-related health impacts, I suppose. So that's things like, our hospital admissions, deaths, perhaps. Then there's the non-COVID related, so that's the kind of wider sphere of the health impact. So around maybe delayed appointments, maybe longer waiting lists, mental health impacts, people's mental well-being. Then we had very much, my scope was focused on the society and the economy side of things, and I think that's where where the Fairer Scotland duty was recognised. Again, not necessarily labelled as the Fairer Scotland duty, but that's very much what the discussion was around. So society was thinking about, how are we seeing our people and communities changing, and economies, what impact have we seen on businesses, employers, employees in the area. And it was about, again, recognising that there will be different impacts on different groups in different ways, and that will change over time. So I spoke to, like I said, went back to, it was quite an ongoing dialogue of going back to our corporate management team and our crisis resilience management team, as well as our elected members, to talk about what we were seeing around these 2 of the 4 harms. So from a society point of view, and I think, a lot of this Miriam spoke about earlier in terms of the inequality of outcome, is that we were seeing a different profile of people who were requiring financial support. So locally, we were starting to get some evidence, some feedback from our services about the people who were coming to us for maybe money advice support, maybe income maximisation support, employment support, and we were seeing that there was more low income households coming to us more than they ever had been before. So we had a huge increase in low income households, and we knew that they'd been disproportionately affected. They were then almost competing with a kind of new cohort that we were coming across, which was this sort of new poverty. So they were households that had previously been just about managing, they were sort of getting by month to month or week to week, but perhaps they had a small amount of savings, as Miriam had mentioned earlier. Perhaps they had a small amount of savings that they could rely on, or perhaps they didn't, but actually that 20% drop in income, or one person no longer earning, were our kind of new cohort of poverty. So we saw the Money Advice and Rights team, who work within the local authority, and our Citizens Advice Bureau were sort of two of the frontline services that were very much seeing this impact in terms of financial vulnerability. They were both reporting seeing an increased proportion of newly unemployed residents who were seeking advice and support. They were seeing more employed people than they ever had been before, so people who were still employed, but they were requiring support where they hadn't in the past. We also saw people coming from different geographical locations. So if anybody knows East Renfrewshire, it's sort of regarded as a leafy suburb in an affluent area, and whilst that's true in some parts of the authority, we have several pockets of deprivation, and that had maybe been the focus of support in previous times, but actually as a result of COVID, we were finding that many residents were approaching for support from the ones that were more traditionally affluent. And I think, Miriam had spoken earlier about the stigma of poverty, and actually this, in some ways, that opened up that dialogue, and it took the conversation did become to change around stigma, and actually, people's circumstances are changing, and it's okay to ask for help and support. So we did see a different geographical impact. We also saw in East Renfrewshire more retired residents looking for support. So older people who'd seen changes in their circumstances. So although they hadn't maybe been affected by the employment side of things, they had maybe seen an increase in their cost of living. We also saw different types of support that were being required around socioeconomic deprivation. So we were seeing more people, like I say, who are making contact for the first time. They perhaps hadn't used money advice services before. So they were looking for basic advice and information. Where do I start? How do I claim benefits? What am I entitled to? I don't know. This is a new area. And actually that requires a lot of in-depth time from call handlers to go through that. And actually a lot of the time it's not, what they don't find at the end of it is there's no financial gain, which is how they'll report in terms of an uplift in income for households. So they weren't able to demonstrate financial gain, but it was still taking a lot of officer time to do that. So one of the things that we did in relation to that was try to create some more online tools and self-directed support. So we built up an area of the website. We had an understanding that a lot of those customers who were coming looking for that first time information were quite tech savvy, they were maybe quite literate, they were able to navigate systems themselves, so they didn't know where to begin, but we gave them that starting point. We also saw a huge increase in demand on our Scottish Welfare Fund. We actually had, in the space of a year, there was an increase, it doubled, sorry. So there was a huge increase in that, and again that had an impact on what our staff response was like, and the waiting times for people to get those applications in and get them processed. We saw new support, as I mentioned. There was that crisis at the start around provision of food deliveries and free school meals being home delivered, which then became almost mainstreamed, and I know a lot of us now will be processing payments for free school meals, but that's that is something we didn't used to give support for school meals over the summer holidays or the winter holidays. We've been doing that now. So there's the administrative part in the background in doing that. There was also this whole new process of COVID hardship payments that we hadn't had before. We had set aside some budget to provide support to those who had lost income due to COVID. We've provided shopping vouchers, additional supports for outdoor learning. We talked earlier about school uniform, and all of a sudden when kids did go back to school, they were outside all the time. So it was, waterproofs and wellies and those kind of practical supports that were needed. And I'd mentioned as well around the digital support, so providing provision of devices and connectivity, but then also the support to use that. So creating some digital champions, having working very much with the third sector interface and our voluntary partners to provide support to those people who had never been online before, or perhaps weren't as digital savvy as they needed to be to continue to connect. And I think the other thing in terms of the societal impacts is the huge impact in terms of well-being, loneliness, isolation. And again, we were seeing that the people who were living in the poorest areas were most likely to be more socially isolated and need more well-being support. So in terms of the economy, we had a lot of our kind of economic development team, our employment partners, our Skills Development Scotland and the sort of wider local employability partnership. We're looking at the data that we were getting back in terms of what's happening in our economy. I'm sure it's reflected nationally, but also each local authority will have seen the same, where a huge increase in the number of residents who, an appearance of residents on furlough, because we'd never had that before. So the numbers of people on furlough, huge increase in the number of people who were out of work. And again, when we drilled into that, we see disproportionately younger people most impacted there as well, sort of our 18 to 24-year-olds in the area. And as I mentioned, that often then meant that we had these newly unemployed residents who were work ready and more likely, perhaps more appealing to some of our local employers than those who are long-term unemployed. So that again pushed those long-term unemployed further down this kind of waiting list of support or opportunities for jobs. And the furlough situation obviously is still ongoing in terms of, we know that that's been extended till next month, but beyond that, we don't know. Will those residents then be added to that cohort of newly unemployed? Will there be extra demands as well? Will they have jobs to go back to? We also saw business survival was something that was monitored as well. There were fewer new businesses starting up in the area, therefore less local employment opportunity for our residents. And we saw for quite some time we were monitoring the sort of town centre footfall. So we've got a few town centre locations, and there had been a huge decrease in that footfall, which meant around 75% of the businesses had seen a loss of income, they'd seen a loss of customers. We have been monitoring those trends, and they're starting to go up gradually again now as we've come into level 0, which is great, but obviously we'll keep an eye on that. So I think what's probably important to recognise in terms of socioeconomic impact is this use of data, and I think Miriam had mentioned earlier about having that evidence to be able to present and to understand what impact you're having when you're taking actions. So we've gathered, we've created what's called a 4 harms dashboard. So that's looking at the available data at a national, local and service level against each of those harms. So as I mentioned before, the health impact. So we're looking at things like Public Health Scotland open data, which is around positive cases and test numbers. We're looking at some of the local data that we've got around self-isolation cases, the call levels that we're getting, people looking for self-isolation support. We've also been monitoring some of the societal and economic impacts, as I've mentioned, around the some of the NOMIS data around unemployment information from DWP, But we've also looked at some of the kind of the societal impacts that again, referring to what Miriam had mentioned earlier around things like school attendance. We're looking at CMIS data around, homelessness presentations from housing, free school meal claimants. How are we seeing changes in those things as well? On top of that, we have got our citizens panel, who we normally consult on an annual basis. So on the last citizens panel, we asked about the impact of COVID. So we've taken some information there to have an understanding about how has their well-being, their financial situation, their connection to communities changed as a result of COVID. And at this point, we're just initiating a new piece of research around what we're calling our humanitarian research, and that's we've specifically set aside budget from some of the Scottish Government money which has been allowed for that, to do some in-depth research. So we're going to do a number of telephone interviews, focus groups. Again, we're working with the third sector interface and voluntary sector on this, but that will be speaking to residents, who partners and stakeholders, and trying to have an understanding about how they have been affected by COVID and what impact that has had on their financial situation as well as their well-being. Now, that's, as Miriam said, that can be quite challenging. People quite often don't want to talk to you about poverty. You don't get people that say we just want to. So it will all be kind of cased in a it's quite a lengthy telephone survey, but it will be cased in the impact of COVID, with financial implications being fed in there where appropriate. And what that's going to do really is, in the short term, it's going to help us with how we allocate funding. So we have still got, like many of you, we've got funding from Scottish Government which has to be spent by March 2022. We have allocated around half of the funding that we have got. So that's, for anyone that's familiar with it, you might be recognised the pot of fund that we got for the food fund, and then we had stuff that, I think it was supporting people money, it was called, and then there was level 4. It's come in different batches along the way with different names, but we have allocated around half of that budget so far internally across our services with a socio-economic impact in mind. So we've allocated it to things, we've got services who've applied for money and for things like provision of free breakfasts in schools, and we've done that within a number of our schools which are in the lower SIND areas. So we've focused on that. We've also looked at some funding around detached youth work. So we've found a lot of kind of teenagers and young people who are spending more time outdoors, less places for them to go, and perhaps there's some antisocial behaviour going on. So we're having some youth work staff out there, and we've funded additional supports to go and do that. Again, in some of our poorer areas, we've seen that at a higher level than others. So there have been some sort of short-term things internally which we've funded, but we've also set aside about half the budget, as I mentioned, and that's going to be available to community organisations to bid for in the autumn time this year. And what we'll do is we'll take the data that we've got from our humanitarian research to have an understanding about the highest level of need. So, we're going to have that data broken down. So if we find that it's older people or people in particular geographical location, or it's families, or it's particular ethnic groups, then that would be applied in a weighting criteria to when the community organisations bid for their funding, so that we can try and target that funding to those most in need and those most impacted by COVID through a poverty lens. So next steps, really, as I said, we've got the sort of short-term funding implications for that, but there's also that longer-term vision, because actually this isn't just about the impact of COVID, it's about longer-term planning and how we support the most disadvantaged residents that we have. So it will also feed into our kind of medium-term planning in terms of our LOIP, our local outcome improvement plan. We're also looking to feed it into our community planning actions, and how do they reflect what the change in need is for our local area over the next 10 years and beyond. And it's about trying to continue to monitor and report on that information, to use it to feed and to use it as an evidence bank as we're making decisions going forward. So as Miriam had said before, as we go through that process and we want to understand what evidence we've got to justify decision making, to inform decision making, or to help us think about mitigating factors. We're hoping that this kind of wealth of data, both qualitative and quantitative, that we have, will be in a position to do that. And hopefully me spending the last year banging on it at however many meetings and senior leaderships has done that awareness raising to make sure that that is in the forefront of people's minds as they're taking decision and action. So thank you for listening.